The before, where you can see scalp, look at this, in 6 months, just once a day, and not just once a day, 6 minutes a day. In 6 months, you could see so much more hair. This is an FDA cleared device that has been proven to really reduce hair loss and help hair regrowth. Look at this. For this woman, what a game changer. A complete difference. This is before is like, okay, I'm gonna have to start wearing wigs every day or hats every day. In 12 months, just 6 minutes a day wearing the Capillus cap that you could get in the hair restoring doctor's offices for $2,000. We've got a very special price for you. Look at that, 3 months to be able to see hair regrowth. Now here at HSN, we have some very important celebrity hairstylists, and one of our favorites is Martino Cartier. He actually has a personal experience with Capillus. We want you to hear from him.
My name is Martino Cartier, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin, and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money, and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
You're gonna love your hair, guaranteed. And we've even extended our very generous HSN return policy. Now on everything at HSN, because everyone's kind of stuck at home right now, we understand, we've extended our return policy to 90 days. On Capillus, we are giving you an entire 6 months to stop your hair loss and to regrow your hair, guaranteed, or return it and a full refund of your purchase price, no questions asked. Now your purchase price is a full $300 less than it will be after this price is gone. $1,699 is truly an investment. It's an investment in yourself, and you can even pay in interest-free installments of $283.17. We will ship it to you for free. Give this a try. We've included all of the great extras as well. An extra case. You've got the battery pack. This will charge. What we're showing you right there is the Cap Plus activator. We're gonna explain all that. You can order yours $700-947, but I had to bring in an expert, Barry Pintar, who is a hair loss expert and has talked with thousands and thousands of people just like you who have been dealing with hair loss, and you have experienced it yourself and experienced the difference.
And I started when I was in my 20s, and it was terrible, and this technology wasn't around for me. However, I was able to get it to the point where I was able to catch all of this and bring it. I gotta bring a before and after photo at some time.
Yeah, let's do.
If you would have seen me even in my 30s, how much hair I have now. And you may wonder, well, why don't you have hair here right now? Because those follicles were dead and gone. And it's important that we understand that we are up against a time clock, because when follicles are dead and gone, your only option is surgery that costs in the 5 figures. So what we're going to do, Shannon, which I'm so excited, you're a newbie to me.
I am a newbie, yes.
6 years at HSN, but our first time together. But here's what's that's great. So if you've seen this presentation before, chances are good you're gonna ask me things other people haven't asked. And because I've sat with thousands of men and women just like you to answer questions just like yours, we're actually gonna have a virtual consultation here, because I really want you to understand what hair loss is, why it's happening, what are the real medical options, not just Capillus, but all of them. We're gonna go over all of that today.
Okay, and if you have a question that maybe we haven't answered or we haven't quite gotten to it as quickly as you're thinking of it, go ahead and please give us a phone call. Our phone lines are open for you. Our phone lines are open to talk to you. You can ask any questions. We are live right now. You can also, if you use Capillus, we always get testimonials from you. I say always. This is my first time, but I've watched so many presentations. 866-376-8255 for you to give us a call. You can always order on hsn.com as well, and you can use that item number 700-947. But we will answer every question that you have. What is it about Capillus that makes this doctor recommended, that gives this the FDA clearance that other devices don't have. This is guaranteed to work for you, and it looks really interesting. And I've actually seen a lot cheaper devices that have red lights.
There are a lot of knockoffs that aren't lasers, that are literally Christmas tree lights.
So these are lasers.
These are medical grade lasers. Class 3 are lasers. I'm gonna move my fingers and it's gonna turn off because of the safety sensors, but if you wanna get in there, you're going to see these tube-like things that are lasers used in many medical applications that are actually FDA cleared in terms of the entire technology. Also understand this is the professional grade version with 202 lasers, just like you're seeing right there. That means a lot because you may have seen something that was 8 lasers or 40 lasers, and it, of course, was at a different price point. When we say this is the FDA cleared technology that a doctor's office hands to their patients, that is what this is. So let's talk about what that laser is doing. So for starters, we're all born with healthy follicles, okay? Healthy cells in those follicles. What happens genetically? The most common reason, that follicle is told it's time to die, way ahead of its time. The cells actually start dying and the follicle actually starts miniaturizing. That's the medical term. A lot of people call it a root. It gets smaller and smaller and smaller until eventually it's gone. That's what permanent baldness is. So what does the medical community want to do? Very specifically, that healthy follicle that's miniaturizing, we want to catch it before it's gone with something that the medical community recognizes. In this case, what we're doing is we're using a very specific color spectrum of light that your hair will allow to pass through it, that your skin will allow to pass through it. Very similar to photosynthesis in the plant. Light equals life, right? This very specific, safe color spectrum of light is going to hit that dying follicle, stimulate the mitochondria in the cell of that follicle. Now this dying follicle says, wait, I don't have to die. I have everything I need to become healthy again, which is why a little tiny hair on an unhealthy follicle starts getting bigger again. Can we bring up Daniel again, guys? Because now it's going to make more sense to you. So when we say helps to stop hair loss, obviously we're going to freeze it in time. But if we look at Daniel, you're going to see where we not only froze it in time and that he stopped losing hair, he actually looks as if he's regrowing hair. Take a look. See that? I mean, Shannon, is that not crazy?
So you could see
does it
his
make
scalp
sense now?
all
So you see
over.
his scalp?
Yeah.
What's happening there is there are actually tiny baby follicles in there with tiny baby hairs that the human eye can't even see.
Okay.
So now we're bringing in this specific medical grade, FDA cleared spectrum of light. It's bringing them back to life. So you see how it all makes sense when you connect the dots?
Yeah.
Because look at the after. 6 months later, the amount of time you get to keep this at home to see if it works for yourself, those little tiny dying follicles came back to full life, meaning the hair came back to full life. If that's, I can't tell you how huge that is to a hair loss sufferer. Because this is a gigantic problem for them. And to see that there's now a medical solution is off the charts.
And a medical solution that you don't have to pay $80 a visit for 3 times a week to go.
Some people still do for this laser treatment,
and it's this same laser treatment, and here's why. This is why you would pay $80 3 times a week.
And that's Yvonne, and you may say, well, wait, 12 months, I would think she had more. You have to understand, what we're talking about here is androgenic alopecia, androhuman, genetic. Alopecia, the term for hair loss. Everyone's different. But here's the good news for Yvonne. Aside from the fact that, believe me, she was so thrilled that her part filled in, that she has bangs now that she didn't before. That look how shiny the sides are. But she is only halfway there. It takes 2 years for that unhealthy follicle to become healthy again and grow back to that full hair. So as well as she's doing there, she has a much longer way to go.
Sure, and all she did was wear a cap for 6 minutes a day. She could have been making a pot of coffee. She could have been putting on her makeup. She could have been brushing her teeth.
She could have been commuting to work back and forth. A lot of people do this in their cars because it's a cap. No one knows what you're doing.
It just looks like a cap, and you can, and I did ask, of course, you can switch it out with any other different cap that doesn't say Capillus on it if you don't want to give away what you're actually doing.
In a few minutes, we're going to go for a little walk to our beautiful model Sonia, and you'll see she switched it out for a pink cap.
Now, you know, sometimes people will say, and we were talking ahead of time, this was my very first time meeting Barry, I have a medical condition that caused me to start losing my hair. I went to the doctor, now this is about 7 years ago, before this technology was available in homes, and she said, looks like you're gonna need to get a wig. That was the answer. That was my doctor's answer. If you've had similar questions, similar results, even a medical condition that has caused you to lose your hair, it doesn't matter the cause. If you are losing your hair, and it could be here, it could be all over. If your ponytail, if you're a woman and your ponytail is starting to get a little bit finer, a little bit thinner, you're starting to see a lot of hair in the drain, you see a lot of hair in the brush, you're noticing that your hair just doesn't seem to quite grow as long as it did, you're losing your hair. I hate to be the bearer of bad news. We can deny it to ourselves till it's all gone, but this is a chance to stop the hair loss and start regrowing your hair. Within 6 months, your hair will not only not be as thin as it is, it will be regrowing, and it will continue to. You've got 6 months to try it out. If this doesn't work for you, you're one of the small, 1.5% maybe that it won't work for.
I've literally never met anybody who hasn't. Now keep in mind.
And you've met thousands of people.
Thousands, and I work with doctors all over the place. And which brings up something I would love to address that you mentioned. Guess what? You did something new.
What?
I know, you said, I told you something new is gonna come up that I never talked about before. Here's what you have heard me say before. If you hear me say nothing else, please know that medical technology has advanced to the point where you can do something to help stop hair loss and help regrowth. I've said that before. But what that means is, as this medical technology is advancing, so is the medical community's knowledge of it. So let me give you some background.
Okay, 1 second, sorry. Oh, there we go. We're showing the inside of it, and I was like, I know that this has got it's a very specific safety sensor cap. All right, I just wanted to make sure everybody knows.
No,
it does work, and when you put it on your head, it does work. Okay, so go ahead.
If it was on your head, it would pop in. So here's Shannon suffering from probably a hypo, whatever the situation was to cause hair loss, okay? Goes to her doctor and says there's nothing you can do. So one of the things that I do, that's my job, my actual title is physician relations, which I do now. In the past, I've sat with thousands of you and explained to you all these things I'm explaining, but I also do this to doctors, to med students. I've been at a big, giant hospital in Cleveland, where I have sat there and had conferences with doctors and their med students to explain this technology because, and this is new, I think I've only talked about this once, let me tell you, when we say doctors use this, why that has all the weight of power behind it. What happened was, as you said, Shannon, people used to go to doctor's offices for this professional grade treatment and sit under what used to look like an old-fashioned hair dryer from the 50s, okay, but it had lasers. Our CEO, Carlos Pena, said, why can't we create something like that that people can do at home? This is really what happened. So we did it. We did a professional grade cap that people can wear at home. Then we did human clinical trials. Oh. You saw those before and afters, right? Even I, who had worked in the medical industry, hadn't seen anything like that. No. We sent them in, for lack of a better word, because they're done by physician investigators. The American Society of Dermatologic Surgery saw them, said, wow. Published them in their medical professional journals. Now, the medical community is seeing this incredible FDA cleared technology out there. When they saw it, all of a sudden they're all like, oh my gosh, I need to offer this treatment to my patients. And now, of course, thousands do. We have thousands of doctors. As a matter of fact, guys upstairs, if we can get Dr. Dinesh ready, we can talk about the fact that at our library, we have thousands of doctors on record who are very happy to go on camera saying this is amazing because we as a medical community want folks to know that this is now available.
Well, we do have Dr. Dinesh ready. We want you to take a listen to what she has to say.
My name is Dr. Adrienne Dinesh. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
Now, Dr. Dinesh is one of thousands of doctors that recommend Capillus to their patients. This one's beeping at me right now. It's telling me, put this on your head, doggone it. It's not calling me a dummy. It's just saying, put it on your head. It only takes 6 minutes a day. It has the battery pack. It's got the charger. This one even has the carrying case, and we've taken $300 off for you to get hair loss results right now, to stop your hair loss and regrow your hair. This is $16.99. I know it's investment. Trust me, I'm looking at it right now to purchase myself. You can get it interest-free for $283.17. It's 6 minutes a day. We've got a 6-month return policy, and we'll ship it to you for free. That's like saying you've got a 6-month risk-free trial, completely risk-free, because we will ship it to you on our dime, and then we will refund every single penny within 6 months if you don't see a difference like we're showing you in the results. But this is an FDA cleared device, and we sometimes, we don't throw that around because you can't. That is a very specific legal term. But what does it mean in this case?
And the cool thing about that is these days when you watch the news, we're hearing a lot from the FDA as we're looking for cures and things that we can use. And what's interesting about it is you're hearing not only the power of that agency, but you're hearing them use words like you've heard me use for the last year here of efficacy and safety. So let's talk about that, how it refers to this, because we're getting so familiar with it. This technology is FDA cleared. What that means is the FDA says this technology has what's called efficacy or effectiveness, meaning the FDA, I mean, think about this, this is huge, is saying this technology will do what we say it will do when we say helps to stop hair loss, help to cause hair regrowth. But still, not enough to get an FDA clearance. To get that FDA clearance through the human clinical trial submitted to them, you have to not only prove efficacy, but you also have to prove safety. So Shannon, what that means is when folks get this box at home from our very secure facility right here in the USA, which we'll talk about later, they are getting a product, they'll see right on that box that FDA clearance, which means the agency of the FDA, they don't take your word for it, my word for it, Dr. Dinesh Martino is saying this technology will help to stop hair loss, will help to cause hair regrowth safely.
Yes. Now, there are some other things that are, and that really clarifies, it's not just red light, it's actually lasers. But there are a few other things, and of course, I've used topical treatments and given you know a little bit of result. Boy, as soon as I stop them, my hair falls right back out again. But what are the options in addition?
You're hitting it, man.
Because I'm there.
I know you're. That's great because you've been through it and you have those questions that I am always asked. So let's walk you through them. When you sat with me in my office, even when I meet with you today in other doctors' offices while I'm training their staff, first I explained what an FDA clearance is. I told you that. Then I let you know your options. And I say to them, as I'll say to you, I am not going to try to tell you to buy this. What is important to me is that you know your options and you make an informed choice. So let me walk you through your options, okay? Ladies, you have 3 that the medical community recognizes that you can do. That's it. I say that because some think there are 0. There's nothing you can do. Some think there are 100, you just haven't Googled enough. You have 3. Let me explain them to you. 1, a topical you put on, leave on twice a day. Minoxidil, been around for a while. Repackaged, rebranded, every year, always on TV, they just call it something different. It's a vasodilator. It opens your blood vessels. It's actually a former prescription medication that's now over the counter. Does it work? Yes, if you put it on and leave it on twice a day. There's always an issue with compliance. You just heard Shannon talk about it. If you don't put it on and leave it on twice a day, when you stop, it stops, okay? Next, PRP. Platelet-rich plasma, where you go to a doctor's office, you get injections into your scalp every 1, 2, 3 months, whatever you can afford is usually how it works. And about 2 months, it's the price of this cap that you buy once, okay? The third one, low-level laser therapy, also known as photobiomodulation. I'm using some bigger words because I know so many of you have spent a lot of time online, okay? So again, ladies, track with me. Minoxidil, PRP, photobiomodulation. Gentlemen, you have one more option that's not available for the ladies, called finasteride, originally a prescription medication and still is for an enlarged prostate in a male with a reduced dosage that is shown to help to stop hair loss, help to cause hair regrowth. But when I mention it, the FDA requires me to say can have side effects, sexual side effects, low sperm count, lack of libido, again, only for men, to the point where it'll say right on the bottle, a pregnant woman can't even touch it.
Oh, wow. Okay, this is just off the cuff, right? Right.
Good.
How unfortunate that as you're getting sexier with more hair, you also have some sexual side effects. I'm just saying.
Okay, so
the less medicine you have
that's
to take
the guy's finasteride option, and there are doctors who won't even prescribe it.
Right, sure.
It has its whole other thing. And look, here's my thing, and again, you're bringing up a very good point. Minoxidil, a vasodilator, is a medicine. PRP, you're getting pain injections into your scalp, numbing, and a lot of stuff going on there. Yeah. Finasteride clearly is a medicine. This is pure, natural light. Don't think that's a gimmick. We know for centuries that light equals life. From photosynthesis to what happens when there are studies of what happens to human beings who don't get enough vitamin D, aren't exposed to light, how they wither away and die. That's what's happening to your follicle. You're seeing it right there. It's dying. It's just great that we know as a medical community, put light in there. It's going to stimulate the mitochondria in the cells all the way down to the molecular level. So now this dying follicle says, I don't have to die, I can grow again, which is what you're seeing. Which is what we're seeing unbelievable results for.
And we'll see results within the first few months, like maybe 3 months. Obviously your hair has to go through a cycle. It's not hot, by the way.
First 3 months you'll notice loss stopped.
Okay,
no, and I'm sorry to interrupt you.
No, that's good. Well, you're the expert.
No, look, that's why you're getting 6 months.
Yes.
Because it's going to take to right about that time until you're looking in the mirror and seeing results. As a matter of fact, that's right where Adam is right now, because he's like 3, 4, 5 months in.
Okay.
He's noticed loss, and you can hear him tell his story. His wife, people around him, all the hosts, people are noticing the difference.
I have noticed a difference, even just in his countenance. In fact, we want you to hear it right from Adam Freeman. If you're new to HSN, Adam Freeman is one of our treasured hosts and a great friend to so many of us. He's gonna share a little bit of his journey with Capillus.
Well, I suppose it's a confidence thing, you know, when you look in the mirror and you start to see that your hair's getting a little bit thinner, and then it just kind of builds up and builds up over time. So when I found Capillus, I thought, well, I'm here at HSN, I might as well give it a go. I'd seen it on TV that it only takes 6 minutes per treatment, so I did it and I tried it. I'm starting to see the difference. My hair's feeling thicker, fuller, and it looks healthier. So yes, I'm definitely happy that I took the chance on Capillus.
Okay, I can already notice a big difference for Adam. That to me was the deciding factor for me. Now, if you're wondering, in 6 minutes, you will be stopping your hair loss and regrowing your hair. An FDA cleared device that not hot, you literally just wear the cap. I'm showing you how I'm touching it. It's soft, and even if you have hair on your head, this is that light that will go right down to your scalp. You owe it to yourself to try it out. We've got a very special price today. You can't find this price in the hair loss clinics where the doctors sell this technology. It would be $19.99 there. Today, it's $16.99. It's $283.17 to get it home, and we are gonna ship it to you on our dime. You do have a full 6 months to try it out so that you can see results. We really want you to be able to see results, but this is your opportunity. So you can order on the phone or you can order on hsn.com. You can even real quickly download an HSN app. It's the one treatment. We're gonna send it right to you, and you do have 6 months. Returns if you don't love it, if you don't see a big difference. But boy, even just the idea that you could possibly stop the hair loss right now, don't lose any more hair, and start to regrow thicker, fuller, more voluminous, more youthful looking hair, it really is worth that. Now we've got, I know you're with Sonia, we're like way over the studio. Of course, we're social distancing even within our giant studios.
Yeah, we do take it seriously here. We have fun, but we certainly take the guidelines seriously, but we certainly want to show you what's going up, which brings up the question, anyone in the room want to see how it works? Any newbies over there want to see how it works?
Yes.
Anybody in the room want to show how it works? Yes, Sonia, our beautiful model who's always here. Okay, here's how it happens. Sonia, and see how she put a pink cap on. Shannon talked about that earlier. She took off the Capillus cap. You can put any cap on. Mine has a Pittsburgh Steelers cap because I'm from Pittsburgh, okay? But this is how simple it is to use. Sonia's gonna put it on her head. She has one button to push right there. Bam. She pushes the button. Did you hear that beep? See the lights light up on top? At this very moment, Sonia is getting a FDA-cleared medical treatment to her follicles. How exciting is that? Now notice that she's giving you a peekaboo under the cap. You saw Shannon talk about this. You see how the lasers are on, but if she moves it far enough off, they pop off. Those are patented safety features in that cap that will automatically turn it off. Now, what else does she have to do? Absolute zero. 6 minutes from now, a computer chip in that cap will automatically turn it off. Which brings up the question that a lot of you have asked, because I've gotten it, which I can ask Sonia. Of course, I know the answers, but Sonia, are you feeling any heat? Are you feeling any tingling, any pain, anything? Nothing, because they're cool lasers. And here's the cool thing, speaking of cool, Sonia is a real, actual user. That's how she became our almost accidental model, because one of the days she was doing this show, we were walking down the hall after the show and she goes, Barry, by the way, I use this in real life. She uses it as a preventative, proactive way, because let's face it, with these models, they're obviously beautiful. That's very proactive. They're choosing to do that. So, and as Shannon mentioned, she started to see hair loss, went to a doctor. She wanted to do something about that. It's that kind of decision you make, but whether it's Adam or Dr. Dinesh or Martino or Sonia or me, the bottom line is we are not talking about a temporary fix. We're talking about growing your real hair with a real FDA-cleared medical device where you can see amazing results, Shannon, like you're seeing in those before and afters.
And these before and afters, 6 months, 6 minutes a day. You can be doing anything. It's got the battery pack, so you can literally walk around. You're not tethered to a wall. You could be driving. You could be doing anything.
Stir fry, you know, vacuuming. Yeah. No, people do it.
Sure.
People go for walks with it.
But these are if he did not have Capillus or do something major, he would have continued to lose his hair.
There's no question that almost every hair loss is progressive. I mean, we don't have to tell you that. You know, if you're one of them, one day you look and you go, oh wow, looks like my hair's getting thinner. Then a couple years later, you're in the mirror going, oh my gosh, I can see my scalp.
Yeah.
You know, this is so serious to you guys. I really get that. Some of you won't go out of the house. Some of you are avoiding family gatherings. Some of you certainly won't go to the class reunion. Some of the gents out there are wearing baseball caps even when they're wearing suits. This is life-altering to so many of you, and I completely understand that. But again, if you hear me say nothing else this whole time we're together, please understand that medical technology has advanced to the point where you can do something about hair loss in the privacy of your own home. We mentioned it earlier. It was just a couple days ago I got a call live on the air from a woman who bought this exact cap, who wore wigs for years, started to use this cap, grew so much hair, she doesn't wear her wig anymore, and she's going out more. She's not afraid people are looking at her, look, oh, she's wearing a wig. 10 minutes later, another woman called in who was just piling on the fibers so folks couldn't see her scalp. She bought this cap at HSN, used it 6 minutes once a day, grew enough hair where she didn't have to wear fibers anymore. And the thing is, look, some people aren't bothered by hair loss, but some people, I will tell you most people.
Oh, who have you?
Most people are. Like, and it's not just like, oh, what a drag, I'm losing my hair. No, some people are almost becoming recluses because they feel like they look old, they're embarrassed so much. You know, we change our clothes, we change makeup, even, you know, whatever. Hair is with us all the time. So when you look at that investment, because again, I've sat with you, we've talked about this, this is such an investment almost into your health and well-being of your overall lifestyle.
Yeah. Your emotional health, your mental health, it really is. It can make such a big difference. Now, we've invited you to call in. If you have a story, go ahead and call in. I may step off because you will probably make me cry. Stories like this, like even the story that you're talking about, it just gives me goosebumps to think about what a difference being able to actually grow your own hair will make. Now, I am just like you, if you are suffering from hair loss, it could be from a medical condition. Maybe you think, oh, it'll come back as soon as I treat that condition. Not necessarily. Most of it is progressive. This is your chance to stop the hair loss and start the regrowth. We're giving you 6 months completely risk-free. So what have you had to lose? I know, trust me, that $16.99 is a big investment. But when you really sort of stretch it out over the long haul, this has got a 2-year minimum manufacturer's warranty.
Yep.
So I know many of you have even owned this for longer. But this is, you've got 6 months to see the results. Over 2 years, even for some of those medical treatments that you, like even the sprays, I'm trying to think, 2 times a day, I feel like it's about probably 40 bucks a month even.
Well, and again, you only buy this once.
One
so
time.
The other things you buy for the rest of your month, the rest of your life.
A lot of times too, women, and I'm talking to you, I'm talking to me, we think, I'll just cover it up with extensions. Well, those extensions, even clip-ins, they're damaging your hair even further. Now you're causing even more damage to your hair. This is not, it's not a Band-Aid. It's not a cover-up. This is not just a hat. Some of you are using hats to cover up. Why not use a hat that will actually stop the hair loss and start your regrowth? Will you give us a call right now? You have nothing to lose. If you are like me, I mentioned this to my husband. I said, I'm selling this cap, this Capillus. I'm sharing this with people. I really think it's time for me to get one. And he was like, $16.99. That's way too much. And I said, hold on. You are not experiencing what I'm experiencing. It's gonna make me cry.
No, okay, then I got a story to make you cry.
Right, it's such a real, I can feel it in my whole body right now.
I know.
It's such a personal issue, hair loss.
So let me tell you a story like this. I've actually kind of stopped telling stories on the air because then I cry.
Yeah.
I'm such a wuss, but if you don't suffer from hair loss, it's hard for you to understand how gigantic this is. But in relation to your story, so again, sat with a lot of people. Oftentimes people would come in with their spouses or significant others. So here comes a husband and wife. And I always had tissue there because there were a lot of tears. Sometimes they got to me, sometimes they didn't. I try to be professional, but I'm with you, right? I've been there. So this guy starts crying and I'm like, wow, it's a husband and wife. And I'm like, he is so upset about his hair loss, and I try to calm him down. Let's just say his name's Joe. Joe, it's okay. We're here to help you. Tell me what's going on. How can we help? And he, see, here I go. Now I got to get real unemotional about it, or I get emotional because it was really one of those moments. And he said, my wife is so upset about her hair loss. She's crying every night. I really want to do something to help her. There I go, whoop-choo, because I have kids and I have a daughter who just got married and all that stuff. He was crying about his wife. So when you're talking about people, sometimes when we have hair loss, it affects so many of us other, because think about it. If you have a significant other or spouse, you have hair loss, you're not going out of the house. Clearly that affects them.
Of course.
I mean, it's hard to put the power on how much this affects folks and how, but now let's flip the coin, how exciting the news is that medical technology has truly advanced to the point where you can do something about it. And that's why it was always so important to me when folks would come into my office that I would give them a full education so that they could really see, like we saw in those before and afters, that people really can now do something about that type of thing.
There's no pain, it's not invasive, it's not a medicine. In 6 months, look at the big difference that this gentleman experienced. What's his name? It's
Daniel.
Daniel, thank you. That Daniel experienced, you can experience results like this. Now, you may notice hair loss at your part. If you're a woman, you may notice it around your hairline. But the fact is, you're losing it all over your head. You can't even see it. Capillus can see it. It gets in every single one of those places that you might be thinning and losing your hair. Like this woman, now, we say in 12 months, we notice her part, but what you don't notice is all over her head, she's got regrowth.
Excellent
she's got
point.
thicker hair.
And that part would have kept getting wider.
It would have.
And that she's only halfway there.
So in 2 years, so if you're just joining us and you're watching right now and you're saying, what is this? Okay, what is this? Is this a spray? Is this a treatment? This is Capillus. This is the only FDA cleared, made in America laser cap that's available for home use. This is the professional strength cap. This is the kind that you can purchase in the hair loss clinics, in the doctor's offices for $2,000. Now, I just found out because I was thinking, okay, you know what, I might get this next month. this price, this $300 off, this is a limited time offer. Every time we've offered the Capillus 202, which is 2.5 times the lasers of the next lower down,
grade, yeah.
right? The consumer grade, it sells out. So this will go back up to the $19.99 price. Today you're saving $300. Today we've got it on 6 interest-free payments of $283, and we'll ship it to you for free.
So you talked about the fact that we're assembled in the USA. You want to go on a field trip?
Let's do.
Well, and it's not just like, hey, let's go on a field trip. This is really important to folks these days because we're hearing how things that are coming from other places may have issues with them. And by the way, before I go there real quick, this is a hypoallergenic silicone gel layer in there. We could talk about that. But let me take you to where we come from, okay? Let's go down to Miami to our factory where we assemble these. Look, notice how you're not seeing conveyor belts, machines popping out plastic. What are you seeing? You are seeing skilled medical technicians putting one laser at a time into your cap that we are going to ship from this facility that is FDA inspected, that is ISO certified, that we pay places like Intertech that you're seeing there on the wall there to audit us. We pay them to make sure that our quality control and our standards are as high as they can be, because I told you about that magazine article. When doctors buy from us, which they do by the thousands and thousands, they expect that kind of treatment. The amazing, awesome thing is, and this is where I try not to sound condescending, HSN truly made the decision to offer this doctor-type product to people to buy at home, and to make matters even 100% better, give you 6 months to see if it works for you, which it will, by the way, because I've never heard it didn't.
Well, we're actually showing
and make a decision for yourself.
So true. We're showing what to expect. So it said like 0 to 3 months, as you were talking about.
This is what we talked about. Yeah, from 0 to 3 months, you're just going to stop losing hair. You may shed a few because a follicle may say, I could do better and grow. That's rare, but it may. 0 to 6 months, when you're like, okay, there's a decrease in hair loss, and you're going to start seeing some fill in. 6 months is right about when it's go time, and you get to keep it all that time. You and folks around you are going to start noticing that you are growing more hair. By 12 months, there's no question. You have all the way up until 24 months or 2 months where you get the most notable results, because again, those tiny, we can show those follicles again, those tiny baby fine follicles that are barely hanging on, that are miniaturizing, that we caught right before they died, that had a tiny transparent hair that the human eye couldn't see, have now come back to full life. That will take months, because we're not talking about a cosmetic, we're talking about truly regrowing your hair. You're gonna look in the mirror, everyone around is going to ask you, what are you doing? Because hair, what do we notice? We notice, my mother notices teeth. I gotta throw teeth in there. My mother's all about the teeth, okay? Or the eyes, you hear people say. But in our society, if you want to talk where the money goes, what people are obsessed with, it's hair. That's why losing it is huge to people.
Sure, it really is. Now, we talk about how you can purchase this in doctor's offices for $2,000. We've got a very special price for you, a limited time only price. Now, a lot of you are on the phone. You can also go to hsn.com. And again, if you have any questions at all, just ask your representative on the phone to let you be put through. Say, Shannon invited you to be part of the show, or if you use Capillus or you've noticed results, please give us a call. We would love to hear your own testimonials. But how about hearing from a doctor? Dr. Deness has presented to you her reasons that Capillus is the one that she recommends. Take a listen.
My name is Dr. Adrienne Deness. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
And you're
I love
done.
that. And you're done. It's so simple. It is battery operated. It comes with the charger for your battery, and you can change out the hat as well. So if you don't want your hat to say Capillus, it doesn't have to. It's got that medical grade cap right in here, and you can pop your own cap on top of it. If you're in your house, wear whatever you want, right? It's 6 minutes a day. It even comes with that carrying case because you never want to be without it. Now, this is for you if you are losing your hair, and it's for you today because you'll save $300 $150. If you're thinking, I don't know if it's for me, you've got 6 months risk-free to try it out, or we will refund your money. But I know that there are a lot of, because this is recommended by doctors, there's so much research that goes into who this works for, how it works. Can you give us sort of an understanding of who this is for?
Absolutely. A lot of times I'll get people ask me about alopecia. It's important to understand that alopecia is just a medical term for hair loss. There are all types of alopecia. By far, the most common in the 90% is what's called androgenic alopecia. Andro, human, genic, you inherited, alopecia, okay? That's what this is FDA cleared for. This holds an FDA clearance for androgenic alopecia. It's typically never a mystery to you because you saw mom, dad, uncle, aunt, grandpa, brother, sister, even younger than you, go through it, and now it's time for you to go through it. So let's look at a couple charts so you can see where you are. And these are the types of charts that you would see in a doctor's office where they would classify so they can chart you and say where you are. Okay, this is the Ludwig-Savin classification. Ladies, you're sitting at home, you're like, yep, there I am. I'm the frontal one on the bottom. That's what you saw, Yvonne was there in that before and after. The parts getting wider and wider, probably getting thinner, could be getting thinner in the temple area, also in the vertex, what a lot of people call the crown. Let me underscore, we're talking about genetics here, so it's never the same for anybody. Hair loss speed is never the same for everyone. Hair loss regrowth is never the same for anyone. We all have different patterns. The great news is, what we do have, that it's a definitive umbrella. When you are in that androgenic alopecia area, we have an FDA cleared device that can help. Now, I want to explain that it's not FDA cleared for the bottom two. However, we know, I would never tell one of those ladies, don't get it. I would say, do get it, because a lot of times, again, you're all coming into my office just wanting to stop the loss. You don't even know that you're going to be able to regrow hair. Those folks can stop the loss and regrow hair to a significant point where, let's even backtrack, where now they don't have to wear wigs, they just have to sprinkle on a few fibers every day.
Sure.
But they can have their, you know what I'm saying? Everyone's different. Let's look at the guys real quick, okay? This is classic guys, Norwood, Hamilton, classifications, gray area, FDA cleared. I have tons of number twos coming in saying, wait, no, I am not becoming a number three. That is not happening. No, seriously.
Right, sure.
In our society, you know, and they're starting it. I'm like, you're smart. Well, we heard Sonia say that.
Yes.
She started seeing, oh, wait a minute. No. I'm a model on HSN. This is not happening.
No.
So she uses it. She really uses it in real life. So you're going to see amazing results. And gentlemen, let me talk to you because I know you think, I get it. You're cool. You wear the cap. It's okay. You can shave your head. Hey, if you want to do that, that's terrific. But what I do want you to know is you don't have to. You now have a real medical option where you don't have to, where you saw Daniel, you saw all the other before and afters. You can get to the point where you have that youthful, for lack of a better way of saying it, full head of hair back, where you can really make a difference with an FDA cleared medical device.
Well, this is such a great, I mean, it really is such an important opportunity. I'm delighted to be able to present this with you.
I love it, your questions are awesome.
Because I'm shopping, right?
I
am as well, right? So if you look at Sonia, and I looked at Sonia and I was like, well, what? But Sonia doesn't have hair loss. Right, exactly.
Exactly.
Right? Exactly, that's the point.
You would be surprised at the people walking around who you think they have a great head of hair. This is what they're doing 6 minutes a day.
Sure. Yeah. And now it's got a 2-year warranty. I just did the math in my head really quickly. So it works out to be about $140 a year, that's $70. It's less than a cup of coffee to be able to use this every single day.
Just during the warranty period.
Just during the warranty period, and you'll have so long. I mean, so to be honest, if it lasts longer than the warranty, it's like, what, $1 a day? To be able to save the hair, to stop the hair loss, and regrow the hair. You may have said, you know what, I'll pay anything just to stop the hair loss and keep what I've got. You'll not only keep what you've got, you'll regrow even more. And what I saw in the little image of what this laser is doing, I think I turned mine off, of what the laser is doing is...
Because it's been 6 minutes.
That's exactly it.
It tells us to serve off after 6 minutes.
It's gonna be thicker hair. It's gonna be better hair. I find that sometimes my hair, even when I'm using just kind of like the spray, my hair grows in, it's still a little fine, it's still a little... it's really treating the follicle and saying, wake up, let's get going.
To the healthiest it can possibly be. Think that.
Yeah.
So not only healthier hair,
yeah,
the healthiest. And you touched on a couple things. Can I hit them?
Please.
You talked about the 2-year warranty, okay? Look, we are assembled in the USA with an entire customer service department in the USA. We are not a one and done. We're not gonna hand you this cap and say, see you, good luck, bye-bye. You're seeing where we built them because we want you to see the amazing power behind what an FDA-cleared medical handcrafted device looks like. But go on the other side of that wall and down a few halls, you're gonna see an entire customer service department. What that means is if you get this home and you say, that guy was talking so fast, I have no idea what he said. How do I turn this on? And I would say, I know, I'm sorry. I get a little excited. But look, there's an entire department there to help you. You want to call back 5 minutes later and say, but wait, how come it's not turning on? I'm pushing the button. They'll say, because it has to be on your head, ma'am. My point is, even after that 2 years, we are going to be there to walk with you. We are not a one and done. We're not a mystery company overseas where no one speaks English and there's no number to call in the first place. We're gonna walk you through it step by step, even after that 2-year warranty is there. We're with you the whole step of the way because we wanna see you have those results.
We really do want you to get results, but here's the thing, just like with any pill or spray or cap or anything, you need to use it, and that means you need to order it. Today is your day to get it. I'm talking to you, I'm talking to me. Guess who's buying this as soon as I get off air after my next hour? That's me. I'm gonna put this on flexible payments because it's interest-free. I won't end up paying any more than $16.99. The minimum warranty is 2 years, and it's just 6 minutes a day. I think everybody can do that. 6 minutes a day to be able to stop your hair loss and regrow your hair. This is not just empty promises. This is proven technology. The FDA has said this is a cleared medical device. Yep. This will do exactly what we're saying it will. And if it doesn't for you, you're welcome to send it back. We've extended our return policy all the way through 6 months for you to not just experience the stopping of the hair loss, which you'll see in the first 3 months, but to see the regrowth in the hair. In fact, we've got our celebrity stylist, Martino. If we could show you real quickly, Martino is our celebrity stylist here at HSN and out of New York, but he actually used Capillus himself, so take a listen.
My name is Martino Cardi, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
Clinical results, and I love what Martino said. You will love your hair. This is your hair regrowing on your head, guaranteed 6 months or your money back. And if you are experiencing hair loss, like I have, and you want to stop the hair loss and regrow your hair, or you just want to prevent that hair loss like Sonia, we want you to listen to, because Barry, I know you're over there with Sonia. I don't think Sonia actually has a microphone on, but
no, she doesn't. I still ask her questions all the time anyway, yeah. But hey, wait, we have to stop the presses for a second, Shannon.
Oh, okay.
Because Shannon, the other Shannon Smith, did purchase this and is talking about filling in her bangs. Now, Shannon #1. And when she says she's gonna purchase it, you guys can't see what's happening behind the scenes. No, she's seriously buying it, just like the other Shannon did. And we're gonna be excited to watch your results as well, just like with Sonia here. And we're here to show you how simple it is to use, because I do this because it can't be much more simpler than this. She's gonna put it on her head. She's gonna touch one button, the lights will light up on the top and there will be a beep, so you'll know it's on. And then she has begun her treatment. There is absolutely nothing else she has to do. She's not feeling any tingling. She's not feeling any heat. She's certainly not feeling any pain. However, again, because I've talked to you. Some of you will say, wait, I feel heat. What you're feeling is your natural body heat under any baseball cap. You're just, you know, I get it. You're putting it on your head. We say FDA says it's safe, all that stuff. You're just like super, wait, what's going on up there? But trust me, that's just your natural body heat. If you feel tingling, could that happen? Of course it could. Is it anything dangerous? Of course it's not. You know, it is also increasing blood flow in a very natural, non-medicine way, which is a good thing, in addition to stimulating the cells in your follicles. But the bottom line is, you, like Sonia is doing right now, is actually getting an FDA-cleared medical grade treatment, bringing her follicles back to full and healthy life right now. And you know, we haven't talked about Sonia coverage, okay? So look, okay, see how she tilted that back an inch? Sometimes folks have loss in the back they want to address as well. All you have to do, and I've heard lots of doctors say it, is wear it straight on one day for that 6 minutes, and then tilt it back just an inch, and you'll be, so you're all, I can't walk over to you, but yeah, you got that whole head coverage. So notice even when it's straight on, she's going down to the ears, the full temple area is covered. You have an amazing coverage with this product, but again, wear it straight on one day, tilt it back the inch to next. If you need to, most folks just have loss on the top, the temples, the crown area, so you may not need to do that. But again, it's an option because it's completely hands-free, and that hypoallergenic silicone gel layer, Shannon, will hold it in place the whole entire 6-minute treatment.
And now Sonia has a lot of hair. It's getting right through the hair, right? She didn't have to cut her hair or pull it back or anything.
Excellent, excellent question. So what these are class 3R lasers. I'm gonna get real technical with you for a second, just so you understand, because these are the kind of questions I get when you're sitting in my office and I wanna explain it to you. Watch this red light come down. That is actually specifically, scientifically, 650 nanometers color spectrum of light. What that means is that very color spectrum of light, and I can even show you on the cap as well, is the only range of color spectrum that our hair and our skin allow to pass through it. So if that were, that's not a mistake that it's a red light. If it were blue or green or purple, it would just sit on the top of your scalp.
Okay.
So yes, in answer to your question, it is actually safely going through your hair, going through your scalp, down to the hair follicle, and treating that follicle. Look at my fingers here if you can. Notice how they're lighting up red. You may think that that is because it's a reflection, okay? That is not a reflection. That red that you're seeing there is actually red that's going through my skin into my fingers.
Oh, because it penetrates
because
into
it's
the
650 nanometers of light that our body, remember, light equals life, our bodies love light.
Sure.
That's a specific nanometer, again, used in other medical applications as well, that our body allows to actually pass into it. It's absolutely fascinating biomedical science.
Right.
And it is actually reaching that follicle. It is actually stimulating the mitochondria in that cell. It is actually regrowing that follicle back into life.
Right.
I mean, if you want, we can sit down and go down to the molecular levels. What's happening to the proteins? What's happening to the molecules? Because I do know all that stuff. That's
right.
the kind of stuff I talk about.
You're the
but
expert.
no, you can be rested. But see, that's why it's so great that it's FDA cleared.
Yes.
Because you know, if the FDA is saying this is really doing something, this technology,
right.
They know all this stuff and have seen the clinical trials to prove it.
Yes, for sure. Now, I'm actually showing you, if you were wondering, how'd Sonia get a pink one? I want a pink one. You can actually put whatever hat you have right on top. There you go. See, Sonia just put her own pink cap right on top. Yes, this will fit your head. It's designed to fit your head. It's so comfortable. It's not hot. This is not hot to the touch, light. These are actually lasers.
They're called cool lasers, very specifically.
Lasers.
Yeah, they're called that.
And I've actually seen, and we talked about this a little bit earlier in the presentation, but if you are just joining us, this is important. I've seen other devices on, maybe online or in places that have red lights. Those are just lights, right?
You're without condescending, you're smart.
Well,
no, seriously, you're banging it, man. You're hitting it right on the head because you got some. We used to always talk about LLLT, low-level laser therapy. We don't even use that term anymore because there are people out there who are really ripping you off, who are saying we're LLLT, but they're substituting that word laser for light, low-level light therapy. And guess what you're getting? Christmas tree lights. Aww. And guess what they're doing? Charging near this same price. Again, coming from a mystery country somewhere, you've got to be so careful. Then there are people who are saying LLT using the word lasers. I know you think you're kidding, right? They're putting like 5 lasers in it, and red LEDs everywhere else, Christmas tree lights. Why are they doing that? Because the medical science is so off the charts with results.
Right.
I mean, we're hearing, we're going with the coronavirus and people trying to rip you off saying, take this pill, I mean, it's sad that our world has gotten to the point where there are folks like that, but we've got to be smart consumers. That's why this price that you have really is $300 less than the doctors charge. But the bottom line is, what you're holding there, Shannon, is the cap that doctors sell to their patients.
Truly, the same exact cap
with all lasers.
The Capillus name, with all lasers.
Exactly.
This is the professional level cap. Now, there are a few different levels that Capillus sells. This is the professional level. This is the one that you would spend $2,000 or maybe $80 per treatment 3 times a week just to visit one of these cabs at your doctor's office, instead of renting it or leasing it for hundreds or thousands of dollars more, because you're going to your doctor's office and you're getting this technology. You can use it in the comfort, and I say comfort. It's as comfortable as just wearing a hat around. It's battery operated, and it's just 6 minutes a day. Here's the thing. I understand, truly, as my own pocketbook, $16.99, it's an awful lot of money, but when you really work it out over how long you're gonna be able to use this, 6 minutes a day, to stop the hair loss and to regrow your hair, you owe it to yourself to try it. And we will literally give you 6 months of regrowing your hair before you have to decide, yes, I wanna keep this. 6 months. You can even break it up into interest-free payments over that 6 months. You'll never pay a penny of interest. $83.17. We'll ship it to you for free. You have 0 risk. All you have to gain, though, is all of that beautiful, thick, luxurious, shiny, fresh, new hair, the best hair that your hair can possibly be. Maybe you just have hair that's been damaged, or you've pulled it out by extensions, or you think it's just kind of thin, or as you hit menopause, or as you get older, your hair just gets kind of less. Like, there's less hair in your hair. This is the way to truly transform whatever. So, and we only have a few more minutes left, but what would you say to people who are just now joining us?
Okay, here's what, when you came into my office, I would hit 2 things very hard. Number 1, well, 3, because I would start with this precursor. Please hear me say, medical technology has advanced to the point where we can do something about your hair loss. We can only stop it, we can help to regrow your hair, number 1. Number 2, how do we do that? With an FDA-cleared, real medical device that you own and use at home. FDA clearance means effective and safe. Number 3, ladies specifically, you only have 3 options. They're real, and they are out there. PRP, minoxidil, and photobiomodulation. This is the only one you buy once. I will tell you, Shannon, honestly, it was just the one I recommended because it makes the most sense, and in metadata analysis, where they compare them side by side, have the best results.
Yeah, it's the easiest, too. Now, what we're showing you right there is that Cap Plus activator. So real quickly, that's something that it's $30 off today. It's about 50% off just for our special deal. So the cap is $300 off. Yep. And then the activator, who
I
needs
say
the
it's
activator?
like if you're planting grass, it's like a great fertilizer.
Okay.
You know, it's just, you don't need it. You don't need anything else, but it's gonna add elasticity to your scalp, to your hair, and help block DHT with amazing natural ingredients.
Okay, and then also we've got the Capillus, the entire line with shampoos and conditioners. You can check it all out at hsn.com, but this price will not last. We sell out every single time we have the Capillus professional strength